We know it's big, especially domestic medical travel, over 90% apparently. But more people traveling for procedures increases public health risk, doesn't it?
It does. You see things cited like increased risk of certain infections, like non-tuberculous mycobacteria, linked to medical travel and U.S. data. Authorities in places like HFTP have to think about managing these cross-border health threats proactively.
And institutionally, you mentioned the shared hospital model in Hainan. What are the specific risks there?
Well, you often have visiting teams, sometimes international teams, working in a facility they're not familiar with, alongside local staff they don't usually work with.
So unfamiliar teams and processes.
Exactly, which increases the chance of simple, low-level errors, things like recording a patient's age or medical history incorrectly.
And these might slip through because the hospital itself is just acting as a platform, not managing the visiting team directly.
That's the risk. These foundational errors can get missed and then potentially lead to serious medical accidents down the line, and of course lawsuits.
And the legal framework itself is struggling to keep up.
Massively. Legal regulation nearly always lags behind cutting-edge science. We saw that with the gene editing controversy historically. Provisions remain quite general, which creates a vacuum when something goes wrong. Assigning liability is tough.
And for the tourist, the patient, seeking compensation if things go wrong sounds like a nightmare.
It can be incredibly difficult. First hurdle, jurisdiction. Providers often put choice of court clauses in contracts, forcing you to sue them in their location, not yours.
Making it impractical or impossible for many.
Right. And even if you manage to win a case abroad, actually enforcing that judgment back home or getting the money can be another huge challenge.